Elizabeth. Our next speaker is going to be Elizabeth Helzner.
Good morning, everyone. So it's really an honor to be here. I'd like to start this little talk off by saying that the topic that I have today is really a huge area of research, and I'm only really going to be scratching the surface in this short talk. That said, we know that diet quality is tied to oxidative stress and inflammation, dyslipidemia and hypertension, obesity and diabetes, and we know that diets that are high in calories, highly refined carbohydrates and sugar, salt and fat, in other words, the standard American diet, can all lead to these bad vascular outcomes, which are in turn associated with brain health. Today I'm going to review some of the larger studies that have associated dietary patterns with vascular and neurological outcomes. The diet profiles I'm going to be talking about today are the DASH diet, the Mediterranean diet, and the MIND diet. All of these dietary patterns are centered on fruit and vegetable consumption and encourage consumption of legumes, nuts, and beans, but they vary in their recommendations when it comes to meat, fish, fat, and alcohol. The DASH diet doesn't particularly limit red meat, but recommends less than 2 servings of any type of meat per day. The Mediterranean diet more explicitly limits red meat and encourages the consumption of fish and mild to moderate consumption of alcohol, mainly in the form of red wine. And the MIND diet is a hybrid of the Mediterranean and the DASH diet, and it emphasizes foods that have proven to be beneficial with regard to cognitive function, including berries, green leafy vegetables, and moderate consumption of alcohol, particularly wine. The first study I'm going to talk about is the PREDIMED trial, which was a parallel group randomized controlled trial of 7,447 adults who were at high cardiovascular risk, which was defined as either having type 2 diabetes or at least 3 of the following risk factors: smoking, hypertension, elevated LDL, low HDL, being overweight or obese, or a family history of premature CHD. And the participants were randomized to 3 arms, either a Mediterranean diet with supplemental extra virgin olive oil, a Mediterranean diet supplemented with 30 grams per day of mixed nuts, or a control diet, which was given the advice to reduce dietary fat. And participants were followed for about 4.8 years. The main endpoint of the original study was a composite of MI, stroke, and death from CVD. Secondary endpoints were stroke, MI, death from CVD, and all-cause mortality. And the study was actually stopped at the 4th year of follow-up because of the clear benefits that were associated with the Mediterranean diet profile. Compared to the control group, the people who were on the Mediterranean diet plus extra virgin olive oil were at 31% decreased risk of a CVD outcome, and those on the Mediterranean diet with added nuts were at 28% decreased risk. Then there was a subsample of the PREDIMED trial that looked at cognitive outcomes. And this trial had an average of 6.5 years of follow-up. They measured changes in cognitive composite scores for 3 domains: memory, attention, and executive function, and also global cognitive function. And you can see the assessments that were used in the study here with regard to cognition. The figure shows that changes in cognitive function, Z-scores, measured based on those composite scores over the course of the follow-up. The error bars here indicate the 95% confidence intervals. In these models controlled for demographics, ApoE4 genotype, smoking history, baseline BMI, cholesterol, hyperlipidemia, and statin treatment, and also the use of anticholinergic drugs and overall energy consumption. So compared to the control diet, the people that were randomized to the Mediterranean diet profile showed improvement in memory function and also improvement in frontal cognition, which was the attention and executive function domains, whereas the people who were in the control diet actually showed cognitive decline over time. The next 2 studies looking at the Mediterranean diet were conducted at Columbia University, led by Nick Skarmeas. The first one was done in the NOMAS study, which was a prospective cohort study of stroke that included 2,568 participants followed for an average of 9 years. Adherence to the Mediterranean diet profile was assessed via food frequency questionnaires. The outcomes of interest here were ischemic stroke, incident MI, and vascular death in any of these 3 outcomes. The hazard of any of these vascular events was then associated with quintiles of adherence to the Mediterranean diet profile. After controlling for demographics, physical activity, overall caloric intake, and smoking, higher quintiles of adherence to the diet were associated with about a 28% decreased risk of a vascular event, These results mostly held after further adjustment for hypertension, high cholesterol, and history of cardiac disease. Another investigation, this time in the YCAP study, looked at association of adherence to the Mediterranean diet and change in cognition based on cognitive neuropsychological Z-scores that were associated with 4 cognitive domains, as well as incidence of Alzheimer's disease. And that incidence was based on a consensus diagnostic conference. They also considered measurements of C-reactive protein, serum fasting insulin, and serum total adiponectin measured at study baseline. And again, here Cox models were used to measure tertiles of adherence to the diet and its association with incident AD. And the findings here were actually pretty striking. Compared to the low adherence in the profile, those who were in the middle tertile of adherence were more than 40% less likely to develop Alzheimer's disease over 4 years of follow-up. Findings for the higher tertile compared to the lowest were not statistically significant, though the test for trend over tertiles was significant. Adding biomarker measurements into these models did not significantly change the results, suggesting that the association here between the Mediterranean diet and Alzheimer's disease was not mediated by these factors. Finally, I'd like to highlight a study that was done as part of Rush University Memory and Aging Project in Chicago. In this particular study, 923 participants with food frequency questionnaire data and at least 2 neuropsych measurements were followed for an average of 4.5 years. Using characteristics that I described at the top of the study, participants were characterized based on their adherence to the 3 different dietary profiles: DASH diet, the Mediterranean diet, and the MIND diet. And again, they used the Cox proportional hazards models. And you see here that there was significant protective effect associated with all of these diets, but the protective effect was really notable for the MIND diet. And again, the MIND diet is a little bit different than the Mediterranean diet and the DASH diet in that it really focuses in on components that have been associated with cognitive protection, including berry intake, and leafy greens, and also moderate consumption of alcohol. So just to conclude, these diets are all kind of centered on plant foods. They were associated with decreased vascular risk. Diets have also been associated with better global cognitive function and slower age-related cognitive decline. And the rate reduction in cognitive decline for people in the highest tertile, and this is a study that I didn't include in the slides, but people in the highest tertile of adherence to the MIND diet compared to the lowest, was the equivalent of being 7.5 years younger in age in terms of the speed at which people were experiencing cognitive decline. Positive effects that are linked to these diets are probably associated with their high antioxidant content, polyphenols, and in N3 polyunsaturated fatty acids. And possible mechanisms underlying these benefits include better vascular health that results in better cerebral blood flow, reduced oxidative stress, and neuroinflammation. So it's really been a pleasure to be joining you today, and I hope that you can see that dietary factors really can play a protective role here. Thank you.
Thank you, Beth.